Okay, guys, we're going to be talking about the anatomy of the respiratory system. So, within this first kind of chunk of PowerPoints, 1 through 7, we're going to be talking about different components of the respiratory system. I tried really hard to break them down by category to make them easier to memorize and kind of hone in on. Um, I'm going to try to keep these recordings as short as possible just so that it's easy for you guys to get through them on your own. Hopefully, keep focused. I know that can be really hard with online learning. I struggle myself in some of my online classes. So, I'm just going to get started here. And as I go through, I'll highlight what you guys are required to memorize and know, and you'll kind of start to see the way that this is going to shape up. So, this first one here, we're going to be talking about the bony thorax or the skeletal system. The first thing that I want to draw your attention to here that you guys are going to be responsible for knowing is this right here. It's made up of three different structures that you guys are going to know. This is your sternum. Your sternum has this top part here, which is called your manubrium. You guys are going to be responsible for knowing that. Then it connects right here to the body. And then down here is the xiphoid process, okay? So your sternum as a whole is made out of your manubrium, the body, and the xiphoid process. Part of the reason that we care about this is one of the larger roles that we play as RTs in codes and situations like that is we are one of the people that does compressions. Obviously, we're going to be monitoring the airway, but that's also a role that we fill. And hand placement on the sternum is very, very important when you're doing compressions. If you're too far up here, you're not going to be compressing on the heart where you need to create that fill of blood and kind of mimic circulation. And if you're too far down on this here, this xiphoid process, this small little bone, this can actually break off very, very easily and do some damage. So manubrium, body, and then this is the xiphoid process. Another thing that I want to draw your attention to just quickly is where the manubrium joins the body is called your sternal angle or the angle of Louis. And the reason I like to point that out and really want you guys to kind of commit that angle of Louis to memory is it's used as a reference point on the board exams and some other exams. So again, where the manubrium meets the body of the sternum is called that sternal angle or the angle of Louis. The other thing that I really want to draw your guys' attention to over here is kind of these rib categories. So in survey, you guys should have learned that we have 12 ribs. Within those are categories. So you have what are known as true ribs, which are your ribs 1 through 7, and then you have false ribs, which are 8 through 12. And really, all that is saying is the true ribs, these 1 through 7, if you kind of follow them around, they're directly connected to your sternum, right? You can see how they connect to the body of the sternum or the manubrium with this costal cartilage. And you guys are going to be kind of learning about the cartilage too, because when you think about the bony structure of your rib cage, it does have to have these flexible points. It's going to be moving your thoracic cage back and forth to try to inflate and deflate your lungs. So it needs to have a flexibility here. So this blue highlighted area is called costal cartilage. So your true ribs are directly connected to your sternum. Your false ribs are indirectly connected. If you look and you kind of follow them, they're actually only attached by the costal cartilage. They don't directly attach to the sternum themselves. They kind of connect to the rib above them with that costal cartilage. So your false ribs are 8 through 12. That's something that you guys are going to want to memorize, the true ribs and the false ribs. Within the false ribs, you have two floating ribs. So that's rib 11 and 12. So if you look and you can kind of follow them around, they're hidden kind of back behind the rib cage here. So they connect to your vertebrae in the back, and then they're going to come around to the anterior side, and they kind of stop here. They don't connect to the costal cartilage. They definitely don't connect to the sternum. That's why they call them the floating ribs. They're also very easy to break if you think about how they're not really connected to anything else here. Those are your floating ribs. So know your true ribs, your false ribs, your floating ribs. The spaces in between ribs are called intercostal spaces. That is also a phrase that you are going to want to memorize. So this diagram in general would be fair game for an exam, and the components on here as well. You do not need to worry about the jugular notch, and you don't need to worry about the clavicular notch. So everything else on here, I definitely want you guys to be aware of and know where it's located. You can disregard the jugular notch and the clavicular notch. So this is just another diagram showing the same thing. So I don't want you guys to get nervous about this being all new information. It's definitely not. It's just another way of looking at the same information. So again, you have the manubrium of the sternum, the body of the sternum. This is the xiphoid process. This is showing you kind of how they count ribs. So if this is your first rib, this is your second rib, this is your second intercostal space. So your intercostal space is kind of numbered to be below um, the rib that you're talking about or referencing. So if you're talking about the second intercostal space, it would be the space below the second rib. The other thing that I want to draw your attention to on this diagram, and you are not going to be responsible for memorizing this diagram. Again, this is just another way to show you the same components that we just went over. This shows you what they call a costal angle. And you guys don't really have to do much with that in this course, but I just want you to be aware that there's a very specific way that your rib cage and your lungs angle down. And it's one of the things on x-rays or CT scans they will look at, and they can talk about your costophrenic angle or your costal angle. You can have blunting or different things that'll change this angle, and that's how they look for fluid or air or other disease processes. We, again, are not really going to do much with it in this course, but I just kind of want you to be aware that that's something you guys will be looking at in disease over the summer. In Egan, they talk about rib motions, and they use the analogy of the bucket handle movement and the pump handle movement. And what they're talking about is when you talk about a bucket handle, if you can envision a bucket and the handle moving up and down, your ribs have this like lateral movement when you breathe in, and you can stand up and do this and put your hands on your rib cage. When you breathe in, your ribs move up laterally. And then from an AP standpoint, so if you're looking at the posterior side of the back here, those are the vertebrae. And then they come around to the anterior side, which is the front, where they attach to the sternum. This also moves out like a pump handle motion. And I have an animation to show you this. But you have your ribs that are moving laterally up and down like a bucket handle. And then you have them from a posterior anterior going up and down like a pump handle. And if this if this analogy doesn't work for you, it's not the end of the world. You don't have to use this analogy. But what you do have to understand is that as you're taking a breath in, your ribs are creating a motion to enlarge your thoracic cavity. Okay, you want your thoracic cage or your rib cage to get larger, to create more volume. And we're going to talk about why that's important. But the simplest thing you can do if you're kind of looking at the slide and trying to imagine it is just stand up, put your hands on your ribs, and take a nice deep breath in, and you'll feel that motion, and you'll feel as your thoracic cavity is getting larger. This is that animation that I was talking about. I think it's kind of a nice way to just get a visual image of the motion of the rib cage and just kind of see the way that they attach and move. Let's see if we can get this to work. Okay. So this is that pump handle. You can kind of see as it's going up and down like a water pump handle, right? And it's just showing that. This is also highlighting those true ribs, and you can see where they're attached to the sternum. The false ribs, again, they're only attached to that costal cartilage. And then it's showing kind of that lateral motion where they move up and out. All right. Again, the big thing here is as you're taking a breath in, your thoracic cavity is getting bigger. As you're breathing out, it's getting smaller. And this kind of shows you the same motion again. This is that bucket handle where you can see on the side there, they're going up and down. So just for visual, that's really all that is, so that you guys can kind of start to get in the headspace of imagining that thoracic cavity getting bigger on inhalation. And we're going to talk a little bit more about the pressures that that creates. The other structures that you're going to be responsible for knowing, okay? And again, don't get too nervous because this isn't adding much in. This is an Egan. You guys will see the same diagram. I'm adding the clavicles here. You have the scapulas. This is looking from an AP perspective, which just means anterior to posterior. So kind of if those phrases are a little rusty, remember that anterior is the front side of the body, posterior is the back side. So if you're looking on this image here and you're looking at the AP perspective, you're going to see obviously the sternum, you're going to see the true ribs, the false ribs, that costal cartilage again. This is a PA view or a posterior anterior view, so it just means that we can see the back side and we're looking through to the front. So knowing that these are the scapula, and then knowing your vertebrae, your L1s, your T, your cervical vertebrae, your thoracic vertebrae, and then your lumbar vertebrae, and getting kind of refreshed with that from survey. So at the end, that's it for that first one. That's the only structures you guys are responsible for. At the end of each PowerPoint, I have your homework assignments. And if you look at the calendar, you can see when they're all due. And they're just titled lecture questions. And I ask you a series of questions from the PowerPoint that you just watched. Hopefully, you can get the answers pretty easily. If you can't get them from the PowerPoint, it's also an Egan's reading as well. On this particular one, I don't have any define this or explain this. When you guys do see those words, I would really challenge you to write things in your own words. Please do not just copy and paste from my own PowerPoint. That drives me bananas. Try to explain it how you understand it. There's a couple of reasons. One, I'm not usually too much of a stickler for points. I really like to try to follow people's thought processes. And I also pay attention to how hard a concept is. If you write it in your own words, how you understand it, and this gets to be more of a thing as we get into more concept heavy versus anatomy heavy lectures. I can see if there's a mistake in your thinking, or I can kind of see where maybe there's a mistake in my teaching where I need to clarify. So I'd really challenge you to take these questions seriously, really try to learn and understand them. Again, it's not so applicable on the anatomy ones because it's much more straightforward, but we do start to get pretty concept heavy as we move through this course. So it's always good practice to start early on. That's all I have for this one. Again, you can look at the calendar to see when these questions are due. What three parts make up the sternum? What are the three categories of ribs? Describe each category of rib. And then how many are in each category. Very, very straightforward A&P questions. Hopefully shouldn't be an issue. If you do ever have an issue with these questions, feel free to email me at any time.